Hello, Good News television viewers. I'm Dr. Thamarai from Pro-Life Maternity and Fertility Hospital, Manapakam. We are here to talk a little bit about women empowerment and medical issues related to women. Based on this medical awareness, I hope you can get some inputs after our conversation.
Hello, doctor. My first question to you would be, what according to you are the most common health issues women neglect but they shouldn't?
Okay. As a woman, we come across many stages in our life, starting from childhood, adolescence, then the reproductive age group, then around menopausal, perimenopausal, menopausal time, and postmenopausal. So, all the problems are related to each individual the period of life in which we are in. So usually the most common neglected ones, if we think, in the adolescent period, it's probably the obesity, eating a lot of junk food, not much of mobility, which is increasing to obesity changes. Then reproductive period, the most common ones are the PCOS and the infertility group. And around perimenopausal age, because the age is going to slightly shifting towards 40 plus. So there are a lot of other problems like BP, sugars, which is also affecting the fertility and regular cycle irregularities. So these are the problems which we come across. And post-menopause, it's usually the post-menopausal bleeding, which has a lot of other complications. So these are the issues which need to be concerned about.
A common question people have is, how often should women get a full gynecological checkup?
Okay, this is a very important question because it's very, very often neglected because people keep thinking, okay, when problems occur, we shall go and see a doctor. But usually adolescent period, usually there's not much of treatment as long as you maintain a healthy lifestyle. During the reproductive age group, it's better once you're planning for pregnancy to have at least one preconceptional visit so that we can just look for any previous diseases in the family or to screen for all BP, sugars and thyroid issues or any genetic issues to be done or any lifestyle changes to be done and to start taking folic acid and supplements which are needed for pregnancy. That should be in the reproductive age group, at least one visit as a preconception. Then during pregnancy, I'm sure your gynecologist will advise you as and when it's required. And after pregnancy, I think at least if no other complaints are there, once in 2 years, and after menopause, at least once in a year to have a regular checkup, scans, and then once in 2 years to get a pap smear done.
That's an important aspect to consider, doctor. Can you talk on some of the early signs of hormonal imbalance and how we can address them?
Okay. Early signs of hormonal imbalance is most likely to be like a PCOS in a reproductive age group. So usually the cycles are sort of irregular. Irregular cycles will lead to difficulty in conceiving. And then also there are other hormonal imbalances along with PCOS which will increase your hair growth, facial hair growth, and then pimples or also known as acne. So all these are the features of early hormonal imbalance. And the earlier we find out whether PCOS is present or not, so we can start off the lifestyle changes and then treatment can be started as early as possible to keep PCOS under control.
Building on that point, I'd like to ask, how does stress impact reproductive health and what can women do to manage it?
Okay, stress plays a major impact in your lifestyle because it affects the lifestyle, it affects your eating pattern, it affects your sleep pattern. So all these will change to your hormonal imbalance. And hormonal imbalance can again lead to one, obesity, PCOS, reproductive issues, and then if you're obese, then it can lead to other metabolic issues like hypertension, diabetes, thyroid issues. So all these are related to stress. It's not like an individual which we can pinpoint and talk about, but it's a cluster of the multiple problems. It's a starting point is one of the starting point is the stress.
That's a great insight, and it brings up another key issue. How can women naturally regulate their menstrual cycles?
Okay, as we told earlier, we need to be having an awareness about PCOS, and we need to have an awareness that if there are some cycles, irregularity in cycle, that you need to see a doctor to know whether it's a normal irregular pattern or if there's anything related to the irregular cycle. So, the earlier you see a gynecologist, at least you can start having some slight changes in your lifestyle, especially having a proper diet at regular intervals, and then to improve your protein diet, and then to start off exercises if you're not already doing. So these are the main things. At least 70 to 80% of the PCOS treatment starts with the lifestyle changes. Only about 20% is the one which who will need treatment. So the 70% lifestyle changes is something which is very, very important, which can be done by every woman at home itself. There's no need to go outside to see a fitness therapist, to see a dietitian, or to go to a gym or anything, which can be started off at home. So basic changes would be needed.
That's a valuable point, doctor, and it makes me wonder, are there any new screening tests that can detect reproductive issues earlier?
Definitely. Now our technology has improved so much, and I want to talk about two important things. One is a breast cancer screening. The next one is the cervical cancer screening. At least there are cancers are not preventable, but at least we can diagnose them earlier. One exception for this is the cervical cancer, which is caused by the virus. So now government is trying to introduce HPV vaccine schedule into the pediatric group also, as a compulsory, as a mandatory. But if you've not taken HPV vaccines, it is always better to take HPV vaccines. There are multiple brands available in the market, which we can tell you how many strains it can cover and things like that. So at least it will prevent the cervical cancer. That is one. But okay, even if we take the cervical cancer vaccine, does it mean that you will not get a cancer? No, that is, it will just help to some extent. We need to have an awareness about it. And every 3 years, we have to get a pap smear done. It's a very simple test. It is very cheap. It's it just causes little bit of inconvenience, not severe pain. So it can be done anytime if you're not having any menstrual bleeding. So it's very important, and once it's done, once in 3 years, you can go ahead if there are no problems. That is about the cervical cancer. Breast cancer is not preventable, but it is very easily diagnosable at an early stage. One, you should learn how to do a self-breast examination. And if you're not very sure how to do a self-breast examination, you can always see a physician, and then they can let you know how to do it. And still, if you are in doubt, at least once you cross the 35, 40 years, maybe clinical evaluation must be done at least once a year. So in case we can find a small lump or something, we can get an early mammogram done, and the prognosis is much better when it's diagnosed at an earlier stage. So these are the two things which I really wanted to mention, which can affect your lifestyle a lot.
That's one side of the issue, but what about genetics playing a role in women's health risks?
Yes, genetics plays a big role in a women's health. So starting from the regular metabolic disorders, reproductive health group, cancers, and so many other factors. So not always all people have some problems, but then that is the reason why we need to have a preconception. That is, before you get pregnant, you need to have at least one checkup done, so that we can identify if there are any genetic issues. One, to look for any genetic issues in the woman itself, and then once she conceives, to know whether there are any problems later for the fetus which is developing. Not only women's pedigree is important, even male partner's pedigree is also important, so that we can make out if there are any genetic issues which are we need to be aware of, so that in the future, in the pregnancies, we know what has to be followed up.
Shifting gears a little, let's discuss what is PCOD, how is it different from PCOS?
PCOD is polycystic ovarian syndrome or polycystic ovarian disease. Not much difference, syndrome and disease. It's all the symptoms are all the same. It's just that little bit of mild definition differences are there with diagnostic criteria changes. So PCOS, most commonly, it involves irregular cycles. It's like it's a prolonged cycles, or some people get shorter cycles or prolonged cycles, and then once in 2 months, once in 3 months, it just goes on like like irregular cycles, and then once prolonged cycle followed by heavy bleeding. So this can be one of the causes. Then once you have PCOS, the to get pregnant, to conceive, it becomes little difficult. So infertility is the next cause. The next ones are the it causes obesity, facial hair, and other. So all this can cause little bit of physical and mental stress and fatigue. So we need to address each factor accordingly.
For those who may not be aware, could you explain what causes PCOD? Is it genetic or lifestyle related?
It's most likely lifestyle related, and then hormonal. So lifestyle changes are the most important ones to be done before we go in for treatment, like medical treatment for PCOS.
Before we move ahead, I'd like to touch upon something related. Can PCOD be completely cured, doctor?
Not necessarily, but you can keep it under control. At least 70 to 80% of the time you can keep it under control, as long as you have a consistent meal plan, consistent dieting, and then consistent exercise. Even if you're not going to reduce weight, but the consistent exercise regulates your circulating hormones, and then it keeps the ovum from releasing in a good condition, good quality eggs to be released, and then so that your cycles are regular.
If there's one key message you want the audience to take away from this program, what would it be?
Healthy lifestyle, regular checkups, and then have an awareness about the womanhood conditions at the particular age groups, especially the cancer, PCOS awareness, and then reproductive issues awareness.
I would like to thank you, Doctor, on behalf of Good News Television in helping us widen our medical awareness.
Thank you, Good News Television viewers. I hope you had an insight about the issues in the womanhood. Thank you so much.